Welcome to NMS. This is part 2 of the series, Do You Have a Thyroid Problem? And this one's going to deal more with thyroid disorders and metabolism, and it's also going to deal with the medications that normally you can have, so the medical treatments, okay? So thyroid disorders and metabolism. So hyperthyroidism, hypo meaning low, so underactive thyroid. Now this can happen from iodine deficiency, an autoimmune disease such as Hashimoto's thyroiditis, thyroid surgery or radiation, and certain medications such as lithium or amiodarone. Okay, so it's most important to realize what can cause it. Now, what does this lead to? Symptoms of hypothyroidism include a slowed metabolism, weight gain, which is mild to moderate, mostly from fluid retention, fatigue, cold intolerance, constipation, dry skin, depression, bradycardia, which is slow heart rate. Okay, so some pretty decent sort of side effects in that one. So B, hyperthyroidism. Hyper meaning fast or overactive thyroid, so Graves' disease, toxic multinodular goiter, thyroiditis, iodine-induced, which is too much iodine, or contrast dyes, increased metabolic rate, okay, weight loss despite increased appetite, heat intolerance, sweating, fatigue, but often with restlessness or insomnia, palpitations of the heart, tremors, and anxiety. Now, iodine and thyroid health, iodine deficiency. So most common preventable cause of intellectual disability in children due to maternal hypothyroidism. Causes goiters, hyperthyroidism, and development issues, seen in regions with low soil, iodine, or lacking iodized salt. Now, iodine excess can trigger hyperthyroidism, in people with pre-existing thyroid nodules, which is Jode-Bastow phenomenon. In others, can also cause transient hyperthyroidism. So this is Wolff-Chaikoff effect, as the thyroid shuts down temporarily to protect against overload. Okay, so when you do take in too much iodine, you actually get like a feedback inhibition. Okay, too much iodine, it stops producing iodine. The daily recommendation for iodine is around 150 micrograms daily for adults and 220 to 290 for pregnant or breastfeeding women. Now, weight and thyroid. So mild hypothyroidism might only cause 5 to 10 pounds of weight gain, mainly from water retention. Now, treating hypothyroidism can help normally with your metabolism, but it doesn't always result in weight loss unless accompanied by a diet lifestyle change. Okay, so hypothyroidism is related to weight loss, often reverses once hormone levels are normalized. Okay, so what that basically means is that with hypothyroidism, okay, you may gain some weight, but it's not normally going to reverse unless you're actually in a calorie deficit and make changes to your lifestyle. Hyperthyroidism related weight loss often reverses once you actually normalize the hormones again. So it's most important to actually get that hormonal control. Energy and thyroid hormones. Okay, so thyroid hormones affect mitochondrial function and ATP production. Okay, so low T3, low cellular energy, fatigue, sluggishness. High T3, excessive stimulation, restlessness, insomnia, muscle breakdown in extreme cases. Thyroid function tests. Now these are basically the interpretation of these. So when you've got TSH, pituitary signal to the thyroid, it's the most sensitive indicator of a thyroid status. Okay, so normally that's one of the blood tests they do, is to see if you're trying to stimulate a lot of thyroid. A high TSH means you're trying to stimulate it, but when you actually partner that with a free T4 test, if that's low, that means that you're trying to stimulate hormonal production of thyroid, but it's not happening. Okay, free T3, the active form is converted from T4, shows how much is active in tissues. Okay, so if you have a problem with free T3, okay, it tells more the cellular level of what's going on with the thyroid, so the metabolism of T4 to T3. Thyroid antibodies, okay, so autoimmune markers, normally with Hashimoto's or Graves'. So these accompany an autoimmune sort of antibody, and so in other words, your body's trying to fight the autoimmune disease. Now, reverse T3, it's the inactive form of T3, and this generally is accompanied by high stress, illness, or low calorie states. So when you're on a low calorie diet for a long time, you produce more RT3, and that can actually lead to a lower metabolism, and that can actually lead to not being able to lose weight, okay? Or because you've lost a lot of weight and your body's slowed its metabolic rate down. Okay, so the thyroid function tests, okay, these are the main labs used to evaluate thyroid function, as already stated. Now, TSH and free T4 are usually enough for a routine screening. If symptoms don't match labs, doctors may check free T3 and reverse T3 to dig deeper. In other words, they're trying to see what's happening on a cellular level. They'll look at what your thyroid gland is doing. If that's not functioning, or if that seems to be functioning correctly, they'll look at a deeper level of your cellular functioning. Excuse me. Now, iodine, how much is enough? So, as we've already said, adults 150 micrograms per day. Pregnancy, 220 micrograms per day. Breastfeeding, 290 grams per day. And children, varying by age, 90 to 120. Okay. Now, an adult would obviously be a 15, 16-year-old person. So that would be a person that would have to have 150 micrograms per day. So as you can see, the amount that you need goes up as you get older to adulthood, in which case then it's around about the same. Sources of iodine. Now, iodized salt, okay, that's one that I definitely use. I put iodized salt on everything, and where I live, they actually, supermarkets stock iodized salt pretty much as a standard salt, okay. Seaweed, which is very rich, sometimes can be too much, okay. Fish and shellfish have a lot of it. Dairy has a bit. Eggs also have iodine in it. Grain products have some iodine. Most of the time, grain products are actually fortified, okay? So excess iodine. Kelp supplements greater than 1100 micrograms per day can actually trigger or worsen thyroid dysfunction, especially if you have some sort of Hashimoto's or Graves'. So having a lot of kelp can actually trigger a Hashimoto's or a Graves' disease. So it's important that you don't have too much of these types of foods. Okay, nutritional and natural thyroid support. So selenium, okay, that helps convert T4 to T3, reduces autoimmune activity. That's normally in your eggs, your Brazil nuts, and also your fish, okay. Zinc, needed for hormonal synthesis and receptor function. Meat, shellfish, legumes, and I also supplement zinc because it's also very good for your testosterone levels. Iron, which is required for thyroid peroxidase, okay? So you need iron, red meat, spinach, beans, okay? Especially red meat. Eggs also have iron as well. Tyrosine, so I mean that's in all your pretty much your different proteins that are complete proteins. So pretty much it modulates your immune system. Now it says here poultry, dairy, fish, but I mean it's also in chicken, it's also in eggs, it's also in your whey protein. So I mean tyrosine in your complete proteins is normally pretty rich, so you don't have to worry too much about tyrosine. Yeah, unless of course maybe you're vegetarian, in which case maybe supplementing amino acids or a protein may be a good option. Vitamin D, that obviously modulates your immune system. Sunlight, but as we get older we don't actually absorb as much sunlight, and it certainly doesn't convert into vitamin D3, the active form, so we do actually need to go on supplement as we get older. It's in fatty fish and fortified foods, okay? Now, I would be looking at the fish variety, and I'd also be looking at getting some sun, but I would be supplementing as we get older. B12, often low in hypothyroidism. Meat, dairy, and fortified cereals. Once again, if you're vegetarian, vitamin D12 may be low. Sometimes people actually do vitamin B12 injections. Now, lifestyle support for thyroid function. Stress management, that increases reverse T3 and worsens autoimmunity, so reducing your stress. Consistent sleep, so regulates your endocrine rhythms, okay? Regular exercise supports metabolism and hormonal balance, so doing your regular exercise, weight training especially. Avoid smoking, thiocyanates impair iodine uptake. Avoid excess soy and raw cruciferous vegetables in iodine deficient individuals. Now, once again, if you're a vegetarian and you're eating a lot of soy products to get your protein, and cruciferous vegetables, obviously because, vegetarian, more vegetables, potentially you could affect your iodine, okay? So you've got to be really careful with those things. Maybe you have to look at iodine supplementation or potentially using iodized salt or kelp. Harmful to the thyroid in excess. Okay, so extreme low-calorie diets increases reverse T3, lowers T3. So the longer you're on a diet, the lower your thyroid levels will be. So if you're on a diet for long periods of time trying to lose weight, diet breaks can be important. Overtraining or exhaustion, so doing a lot of training can actually lower your thyroid levels. So you've got to be really careful with the amount of training you do, especially if you're some sort of maybe endurance athlete or you're training in the gym excessively. Environmental toxins, so BPA in plastics, fluoride in water, perchlorates, okay? So anything that can actually displace iodine, because iodine, chlorine, fluoride, they're all in the same sort of level of the periodic chart, and they can actually be competing ions, so you've got to be careful of fluoride especially. It's a very big competing ion, but also chlorines and perchlorates. These can all affect thyroid signaling as well. Hashimoto's and autoimmunity. So Hashimoto's is the most common cause of hyperthyroidism in developed countries. It's an autoimmune condition. Your immune system attacks your thyroid. Can have normal labs early on, but symptoms still appear due to inflammation. Okay, iodine supplementation in Hashimoto's can be risky if selenium levels are low, so make sure that you're having foods high in selenium as well. Okay, 200 micrograms a day of selenium for about, obviously, around 150 to 200 micrograms of your iodine. Okay, that can actually reduce your TPO antibodies. When I actually was diagnosed with Hashimoto's disease many years ago, I found vitamin D3, especially has to be with K2, and supplemented with magnesium, I found very good for helping with autoimmune diseases. Okay, a gluten-free diet may help with some because it actually helps, because when you're gluten intolerant, sometimes you get problems with absorbing certain nutrients, especially with celiac markers. Okay, anti-inflammatory diets like the Mediterranean diet are very good, and they're often very helpful with that because they're high in fish, and obviously fish is high in iodine. Okay, clinical takeaways. Always test before supplementing iodine. Too much can backfire. Iodine being actually an ion that is deficient in a large amount of the population, I would be probably looking at iodized salt on your food, okay? If you feel symptoms but your TSH is normal, look deeper. Free T3 or reverse T3, as already mentioned. Thyroid function is sensitive to nutrient status, so stress, autoimmunity, and toxin exposure, not just iodine alone, okay? Hormone conversion T4 to T3 happens in the liver, kidneys, and gut, so gut-liver health matters a lot. So good fiber diet and obviously having, foods that can help with the good bacteria in your stomach, and that can actually help with your hormonal sort of balance with your thyroid level. Testing for thyroid conditions typically involves a combination of blood tests, as we said, so your T4, T3, TSH, and reverse T3. T3 and reverse T3, obviously, if they're looking further into cellular stress. Blood tests most common, so as already said, TSH, High TSH suggests hyperthyroidism, low TSH suggests hyperthyroidism. Okay. Free T4 measures active thyroid hormone. So if it's low, that means that you're not producing enough thyroid, and they may look at supplementing T4 into your diet. Okay. Free T3, often checked if hyperthyroidism is suspected, may be elevated even when T4 is normal. So T3 toxicosis. In other words, you're really converting a lot into T3 in the cells, and they're looking for, the product of that. Okay. Physical examination and imaging. So if they believe that you've got a goiter, they'll do some imaging in Graves, dry skin and hair thinning. Okay. So thyroid ultrasound, so check for nodules, cysts, inflammation and structure. Radioactive iodine uptake evaluates thyroid activity and distinguishes types of hyperthyroidism. So Graves versus toxic nodules. Okay. Fine needle aspiration, FNA, which is a biopsy of the thyroid, performed if a thyroid nodule is found and cancer is suspected. When to see a doctor. If you experience symptoms such as fatigue, weight gain, cold, intolerance, constipation, possible hyperthyroidism, if you experience weight loss, heart palpitations, anxiety, heat tolerance, possible hyperthyroidism. Neck swelling, okay, difficulty swallowing, voice changes, and possible structural issues. Now, treating thyroid issues with thyroid medication, standard, okay, evidence-based treatment is levothyroxine or Synthroid or Urothyrox, okay. Synthetic T4 hormone, body converts it to T3 as needed. Standard first-line treatment for most hyperthyroid patients, okay. Dose depends on weight, age, heart health and TSH levels. So they may have to give you more if your levels are very low and if your TSH is not responding. So if it's still very high, they'll give you more. Lifelong treatment may be necessary, especially in autoimmune hypothyroidism, or Hashimoto's. TSH and free T4 tested every 6 to 8 weeks. When starting or adjusting your dose, once stable, test every 6 to 12 months. Now, I'm going to leave the video at that. The next one, I'm going to start looking at alternative medications, okay? These are the less common things that we look at, okay? So keep an eye out for that, and also alternative treatments to alternative medications. So I'm going to leave this video at this. Any questions, any comments, make it in the comments section. This is only going to be on YouTube, so I may make shorter videos on other platforms, but this long form video is only on YouTube. So if you want to rewatch it, you're going to have to come to YouTube for this video. Thanks for listening, guys, and I hope you learnt a lot about the different types of thyroid conditions and treatments in this video. Thanks for listening.